Welcome to the TRT and Hormone Optimization YouTube channel. As a guest today, we have Dr. Jeffrey Ruterbusch with us. Welcome, Jeffrey.
Well, it's good to be back, Stephen. Let's get this done this nice Memorial Day weekend.
Happy Memorial Day. I didn't realize that.
Yeah, thanks. Yeah, it's a special day for me, and of course, Veterans Day also.
Okay. So, first topic. I will read this one out loud because I got it from someone in the Facebook group. Imagine health is not your number one priority, but aesthetics and muscle mass is. In that case, how to use TRT, HRT, and other hormones in your advantage. So for TRT, how high can levels go and still be safe? Would 1500 nanogram per deciliter for a total testosterone still be fine? And concerning HRT, could we add some legal things in order to optimize aesthetics and muscle mass? Since some clinics are prescribing oxandrolone and nandrolone, and what doses of these compounds would be acceptable to play safe? A long question. I'll give you the word, Jeffrey.
Yeah.
Consider subscribing, hit that notification bell, and you'll be on your way.
Here's a long question, so I had to break it up a little bit. Okay, first let me state that this question, there's no books on this. This is something I just gleaned being in the industry for over 4 decades, actually almost 5 decades as a bodybuilder / exercise enthusiast. So I'm drawing on years of experience, being in the gym, years of experience as a retired sports med physician, years of experience as a sports nutritionist. But I also have, I've done some research. I have some books that help me prepare for this lecture a bit. And, one is the famous America on Steroids, Time to Heal by the famous Dr. O'Connor, who we all know. And of course, my standard go-to Bill Llewellyn's book on anabolics. And this is a treasure trove of great information. So, that's the foundation of my answer to this question today, along with, of course, my own experiences. So, yes, I have followed athletes on the record and off the record for many, many decades. I follow my blood work. I was practicing harm reduction medicine before people knew what harm reduction medicine was. Meaning people would come to me in the gym, knowing my background and knowing that I wouldn't give them, I guess, a rough time for being on anabolics because I knew it existed. I had seen it at the gym. And so the answer to the question is this. I have seen many people run testosterone levels greater than 1500, greater than 2000, greater than 2500, greater than 3000 nanograms per deciliter for months to years. And when I say years, I'm talking 15, 20 years with no untoward complications or sequelae that I was privy to. Okay. So yes, I have seen it over and over. I have never, ever seen a patient that presented to me with a bad outcome that I could attribute it to running high numbers of testosterone. All right. And so now you mentioned some legal methods to optimize, I guess, results. Well, legal meaning what? I mean, all these, you mentioned oxandrolone, oxymethylone. Hey, dog. And you mentioned these things. And yeah, but they're not, I mean, obviously they require prescriptions too, but you can get them on the underground, market. So the ones that I'm most familiar with to safely add to a TRT regimen for aesthetics and bodybuilding purposes are the old tried and true original oral anabolic that came up in the 40s, Dianabol, been around forever. As a young man who had a father that worked for SEBA in the 60s, SEBA carried Dianabol. That was one of their drugs. So I was exposed to that in the 60s, not as a personal user myself, but I would see people using it. Remember, back in the day, bodybuilders, meatheads in the gym, we weren't going seeing doctors all the time. We weren't hung up on lab numbers, We weren't. We would just use stuff, dial ourselves in by how we felt, and we never hardly would go to doctors back in the day to have these things measured. So a lot of this thing is anecdotal. But the number one anabolic that people tend to use primarily as a stack, in addition to testosterone, is Anadrol 50. And I have a lot of experience with that. It's an oral hormone. It's an oral medication, as you know, very powerful. So I would recommend you use it for long-term purposes. But I was on it years ago. In fact, the first time I ever ran testosterone with Anadrol 50, I gained 35 pounds in 10 weeks. And it's not uncommon to gain 25 to 35 pounds in 10, 12 weeks running a course of testosterone and Anadrol 50. Then later in life, I added trenbolone acetate to that. And a lot of people will use testosterone, Anadrol 50, and trenbolone. And so in my experience, other than the Anadrol 50, which I only ran that for 10 weeks, gained 35 pounds. After that, I was using nandrolone and trenbolone. And personally, I would get so many tremendous gains in strength with trenbolone. You could get it under an underground market here in Florida by just dialing up a veterinary supply company, and you could order it, and they would ship it to you. But then, of course, those markets have been dried up for the past decade now. But my experiences are with testosterone, Dianabol, trenbolone, and nandrolone. You mentioned Anavar.
Mhm.
That's one I have no personal experience with taking myself, but I have had a lot of patients come to me and have me monitor their blood work, both men and women on Anavar. And that's one that's, I think, highly recommended for women to use because of the minimized androgenic effects of Anavar. So that's one I have a lot of experience with as a physician, not as a user. So again, I need to just summarize that most of what I've seen with people using testosterone or testosterone stacks with Anavar, with Anadrol, with Dianabol or trenbolone, I would do their blood work every 6 months for years, and I wouldn't see any untoward effects regarding things that I thought were dangerous. Obviously, there is a lot of secondary erythrocytosis that would have to be monitored. And back in the day, we weren't even looking at estrogen. Back in the day, I didn't follow it. Still don't follow it. I might measure it now just to make sure that I tell guys, hey, it's too low. Let's get that up a little bit by using testosterone. So having said that, most of my experience as a sports med doc has been monitoring the blood work of men on those stacks I mentioned. And I have not ever seen any untoward effects. Now, again, I'm not saying they don't occur. I'm just saying I've never seen them.
Mhm.
So again, you can run, 1,500, 2,000 plus nanograms per deciliter. But I would only do that personally if I was still seeing some results. I think it's stupid to run those high blood levels if you've plateaued. You've kind of reached your physical plateau, I wouldn't keep doing it. I would take some holidays, but yeah, I have seen blood levels routinely greater than 1,500, greater than 2,000. I knew a guy that was, for 20 years, he was running Trenbolone, Anadrol 50 on occasion, the orals, and in addition to testosterone. And he was never below 1,500 in the 15 or 20 years I measured his blood levels. Never. So that's just my information to the group here about what I've seen out there in the real world doing this for over 4 decades.
Okay, nice, thank you.
And now give this video a thumbs up and go watch one of these videos to learn a ton more about TRT and hormone optimization.